Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. It is my privilege to be here with Dr. Michael Havig, CEO and founder of HealthMe. Michael, great to see you.
Yeah, great to see you again, Logan. Thanks for having me.
I love what you're building. Anything that brings more transparency to healthcare, I think, is a good thing. So break down what you've built.
Yeah, so as a reminder to everybody, what HealthMe really does is we empower patients and payers to know the true cost of healthcare through our consumer-friendly marketplace of transparently priced healthcare bundles.
Tell me how you came to this. You yourself are a surgeon?
Yes, that's correct.
Okay, so you sort of came at it from the provider side and you kind of discovered it and had an eye-opening experience. Tell us about that.
Well, yeah, so I think everyone wants to know the cost of their healthcare, right? I mean, now the government's even requiring us to
That's right.
Give good faith estimates, right? And so I was seeing more and more patients who either needed or wanted to pay directly for their care. These are folks that are uninsured, underinsured, they have high deductibles, maybe they're in sharing ministries and other types of programs where they're really paying the bulk of their healthcare cost up front. And here's the problem, most physicians don't know how to retail their services, right? We've always been told what we're gonna get paid, but we've never really had to originate pricing, right? And so if someone calls a doctor's office, particularly a specialist office, and asks what it costs to see the doctor, they're often said, met with a blank stare.
Did that happen to you in your clinic?
It did, yeah. So I learned really, only because I practice in my hometown and a lot of my friends are these small business owners, that I was turning away cash payers.
Interesting.
Yeah, every practice has a self-pay policy, a piece of paper that is sitting on a desk somewhere, but we don't train our staff in anything really but third-party billing collection. And so if you ask somebody what it costs, the staff is usually can't give an answer. Okay. And so they turn the patient away. It's just easier to say no.
So a piece of this was just figuring out what stuff costs. What was that process like?
Yeah, so interestingly, I mean, healthcare traditionally has been retrospectively priced, right? You see the doctor, you have a set of services, they add up all the services, and you get a bill at the end, and then that bill gets changed and repriced, and all kinds of stuff happens to it that nobody understands, quite frankly. Doctors, patients, even the payers, I think, are a little baffled by the system, right? So what we did is we realized if you want to know the price of something, if you want to know the price of a product, first of all, you have to know what the product is, right? And so in healthcare, we learned we had to just bundle our services, right? So, a visit with an orthopedic surgeon in the office is usually an office visit, it's an x-ray maybe or some other tests, and then a plan to get the patient feeling better. And so we created bundles that represent office visits, surgeries, physical therapy, durable medical equipment, injections, and so we created those bundles, and then you decide, okay, well, what's the price? And when we put those bundles in front of physicians, we realized that they'd never originated pricing before, so they didn't know, right? So then we had to build a database of pricing data. So now we can come in kind of in a turnkey fashion and go to a practice and say, look, you're missing this market of retail payers, if you will. Yeah. You want a direct contract with self-funded employers. You need to bundle and price your services. And we make it really easy to do that.
So part of this is making life easier for like a self-pay payer, but also I believe you're bringing down prices. So talk to me about once you start thinking prospectively about pricing, how does that start to compare to retrospective pricing?
Yeah, so in retrospective pricing, well, it's impossible to give someone a price up front.
Right.
So if you know the price up front and you're the consumer, now you can shop, right?
Yes.
So if you want to buy a new computer, you might see it costs this or these features give you that cost. And in healthcare now we can do that with HealthMe, really. So you can know your cost as a consumer or a payer if you're a self-funded employer. But the doctors, and I notice this personally, you feel more accountable to the price if you're putting it out there, right?
Yeah.
And so
it's almost like just normal free market, forces start to just come into play.
Yeah, exactly. Yeah.
In terms of quality and price.
Yeah, and the crazy thing is, why did it take this long to figure it out in healthcare, right? Like, I mean, there's a lot of reasons, I guess, but
you also have the idea that with retrospective pricing, you might start to fold in other prices that you didn't expect.
Yeah, that's true. Yep. And so with the bundling, we learn through experience what goods might be included in a bundle. Mm-hmm. And when we can include those, we can get more accurate pricing to the patients. And it's kind of crazy because even in my case where I'm pretty knowledgeable about this stuff, personal story since we talked last time is my son, who's a college student, broke his wrist while he's at college, needed surgery. I knew it was going to be expensive probably, but it was, at the end of the day.
I mean, if anybody knew, you should know.
Yeah, I should know, right? and I knew it was going to be expensive, right? But was stunned when the bills started rolling in, and I saw that actually my insurer paid the hospital about $42,000 just for the facility fee, just for that OR room, for an outpatient surgery. And on HealthMe, we have orthopedic surgeons offering that same service coast to coast for around $8,000 all in, not just the facility fee. That's the surgeon, the anesthesia, the facility fee, the implants.
Yeah.
And so you're looking at a 5 or 6x multiple there. So, how can we get those prices in front of more people?
Yeah, it seems a little bit like a no-brainer, right?
Yeah.
So where do the insurers play into this? Because you built a platform that's great for cash pay folks.
Yep.
Any sort of normal guy like me is going to want to save money if I'm paying cash.
Sure.
But if I have insurance, I'm not thinking about the money as much.
Yeah.
So where do you start to work with payers?
Well, yeah, so it's kind of interesting. We've built a big enough network now of transparently priced musculoskeletal care that we've had a lot of those in the self-insured employer ecosystem reach out. So the navigators, the third-party administrators, and other who have discovered one of our clients and discovered their bundles, and they reach out to us and say, hey, can you put us in front of more of these?
Because they want to save money too.
They want, yeah, of course.
Right? Your son's insurer didn't want to pay the $42,000.
If they knew they
ostensibly, right?
Yeah, if they knew they had an option, I'm sure they would have taken it. And
Seems like it.
So the bottom line is we've built a tool where we can basically aggregate all our clients and put their bundled pricing in front of an employer or a self-funded, the ecosystem of navigators and TPAs and others. And the interesting thing about this is what we've done is we've created apples to apples bundles, which I think is unique in the field.
Yep.
Where, and we've heard this from the navigators and the TPAs and others, they say, well, what's your bundle include? Yeah, this bundle's this much, but it doesn't include this. And so kind of like I talked about with the University Health System, it was $42,000 just for the OR.
Yeah.
Another $20,000 for everything else, right? And so our bundles are apple to apple. So knee visit in San Francisco is the same as a knee visit in Miami.
That's helpful.
A surgical bundle like a ACL reconstruction or a knee replacement, the same things are included in New Hampshire that are included in Southern California.
Because for a patient to be a knowledgeable consumer, there has to be some sort of distillation and simplification, because if they were all different, then the consumer would feel like, I don't really know which bundle is worth more.
Yeah, exactly.
It's hard to know.
Yeah, and it's, you don't want to get the kind of bait and switch stuff going on, right?
Yeah.
Where, you look at 2 knee care bundles for an office visit, and one includes an x-ray and the other doesn't.
Yeah.
And then you show up and they're like, oh, yeah, this one I paid less for. But then you get billed $200 for an x-ray, which is more than you maybe paid for the whole bundle.
Yeah.
And so we've really thought through the process.
Interesting.
And we kind of, force is too strong a word, but we encourage our clients and actually require them to offer the same bundles.
Got it.
Not alter them in any way.
Okay. Let's talk macro for a second about transparency regulations. You mentioned this a minute ago. Where do we stand there? Is it causing a big shift in the industry that you're seeing?
I think when this came down the pike in January of 2022, I think everyone thought there'd really be a sea change when it comes to pricing transparency. In the hospital regulatory measures went into effect a year before. They started enforcing that about 18 months later. The government really hasn't enforced it on practices yet, in part because they found it such a hard thing for the practices to comply with.
Yeah. And
it's overwhelmed the program. So we haven't seen, I think, the tide turn in regards to what the intent of the law was.
Okay.
The No Surprises Act. But the tide's slowly moving there, right?
Okay.
And the good thing with our clients is our clients have been compliant since January 7th, 2022. We were the first to really roll out a good faith estimate tool that makes it really easy for patients and the practices to be compliant. So we thought that might be a bigger thing, but it's slowly getting there, and
that's how it is.
Yeah, it's been exciting for us because we're able to it's almost a bonus for our patients. They adopt our platform because they want to be more transparent. They want to kind of access this market of direct payers, and we kind of give them, we like to say we're the only compliancy tool that drives revenue.
Yeah,
that's great.
Degree, right? That's great. So last question, what's next for HealthMe?
Well, as we move into the self-insured employer ecosystem, we're really excited. We signed a letter of intent with a large, basically business consortium of musculoskeletal providers. Represents about 5,000 providers nationally.
Okay.
Which is about 25%.
A consortium of surgery centers?
Yeah, well, it's surgery centers, offices, surgeons. It's kind of a business consortium of large orthopedic practices.
Okay.
And it represents about 25% of the orthopedic workforce.
Oh, wow.
And this organization is looking to connect their providers, their physicians, with self-insured employers. And so they needed a kind of a technology infrastructure to be able to do that.
Yeah.
And a lot of their members are already clients of HealthMe, and so one thing led to another. So this gives us a huge opportunity to kind of triple the size of our network.
Yeah.
And really, we've kind of beefed up our payment rails to accept delayed payments as well as
Oh, nice.
early, prepayments. And we've also had a lot of really fun ways for patients to pay in interesting ways. We now offer financing through Affirm, the buy now, pay later
Nice.
partner of Amazon, for
Yeah,
example.
Same way you buy a mattress or something?
Yeah, exactly. Yeah, people finance barbecue grills. Why not their healthcare, right?
Yeah,
if they need
yeah.
to. So we offer financing. We offer Google Pay, soon Apple Pay. So we're really trying to bring the consumer side of it, not just to the retail payers, but also maybe to some of these self-funded employers. So
I love it.
Really
I
excited
love
about that.
Michael, love what you're doing. Love that you're bringing price transparency to normal patients like me. If I break my wrist, I want to walk into a place and know what I'm going to pay for.
Yeah, exactly.
And know what I'm getting. So I love what you're doing. I hope folks sort of get on the boat of the No Surprises Act, faster and faster. But I know you guys will be one step ahead. So I appreciate the update.
Hey, thanks a lot. Really enjoyed it.
Okay, thanks, Michael.
Yeah, great to see you.